Doctor, what was it that I wanted to ask you? Acne. Like, why does it not go away?
People use acne patches, just clear that acne overnight. I feel it's a waste of money.
I was wondering if that is all marketing gimmick because I'm like, skin is skin.
Screens also emit
Radiation.
This can also cause photoaging and pigment formation.
This is where it gets confusing for normal people. Like,
Yeah.
going and seeing a dermatologist, like just a routine checkup, also be a part of people's lifestyles.
We need to, sit with them, counsel, and what is right product for them.
Now you're like part-time therapist along with.
Yeah.
The internet today is full of skincare advice. Everyone is a skincare expert. The long list of ingredients and products, I don't even know where to start. Add to that, skincare is different for men and for women, for older women and for younger women. Where does an ordinary person even start from? I'll tell you where. But before we go there, I have a request to make. If you're watching this video, please subscribe to our channel. Subscribing is completely free for you. But what it does is it lets us make more good quality, high value content for you. So please subscribe. In today's video, we are going to talk to a leading dermatologist and cosmetologist who will answer all of your skincare queries. This is Amrita, and I welcome you to a brand new podcast on the Momcast, where we are talking to Dr. Nithya Raghunath. Welcome to the Momcast, Dr. Nithya.
Thanks for inviting me, and it's a pleasure being here. And I'm really excited to talk about all the skin care routine and diseases or hair questions, whatever you're trying to shoot at me. And
we have a lot of questions for you. We have a lot of questions for you. So confusing out there, exactly how I just mentioned that a person like me is, like, I have to say, skincare today is more complicated than doing engineering. Because at least there we had steps. Here, everybody is throwing random advice at you. We really need you, doctor.
yeah, that's the big question mark. The problem arises there. So because there is so much information in social media, people already know stuff. And whether they are receiving right stuff or wrong stuff, we are there to answer to their problems. So earlier it used to be only dermatology. We used to give prescription only for clinical conditions, and that's it. Now it's all about skincare routine and using different products. And even a normal person would like to know what products they would want to use, and we need to sit with them, counsel, and what is right product for them. We need to elaborately give the prescription. So even our job has been tough these days.
Your job has also evolved. Now you're like part-time therapist along with being a dermatologist. So, but before we get into all that, I want to start with you. This is something I ask all our guests, that why do they do what they do? But even before that, let us talk about yourself, doctor. What is your background? Are you from Bangalore? What was family like, childhood like? So yeah, please tell us.
So I was born in a small town called Malur in Kolar district.
But Kolar as in the Kolar Goldfields? Kolar?
Yeah, Kolar Goldfields.
Interesting.
So just 1 hour from Bangalore. So my father had to settle there after he completed his medicine. So he was the first doctor to open his setup there. So that's how, we got to settle there. But then I had to pursue my education further in Chennai, and we had to shift to Bangalore ultimately.
Right. So, but still from nearby only, not too far.
Yeah.
And why dermatologist? Why dermatology? Was your father also a dermatologist?
My father is a pediatrician. So I used to see him, patients knock in the middle of the night, and I used to see him, take his little suitcase and then say no to any of the patients, and then he used to go. address them. And I started learning, these healing treatments then itself. And then my passion grew from there on.
Yeah.
So here I am.
Yeah, good for us.
Yeah.
Yeah. No, we have a lot of respect for doctors. In general, Indians have a lot of respect for doctors, but on this show especially, because doctors have been very helpful in providing information. There is always that underlying motivation of let's do what we can for the society, which I find great. Right? It's amazing what you do. Yeah, for the layman out there, doctor, let's explain the term dermatology. Like, what does it exactly mean?
So dermatology, in the sense, it's nothing but science of studying skin, hair, and nail. So people usually, when patients come to me, they ask me, "Doctor, do you also treat hair?" So I'm really taken aback and surprised, because all that we do is study about hair, skin, and nail.
Yeah.
Because they are extensions of skin, hair and nail as well.
Yes, exoskeleton.
Yeah.
Right.
And also, of course, we also study about sexually transmitted diseases. So that's why it's dermatology and venerology. It's not, yeah.
That is
So
brand new
designation
information.
is, yes.
Why this combination of dermatology with venerology?
So basically, in our degree, MD degree, we study about skin function and the diseases, the structure. So anything related to skin. So STDs are mainly transmitted sexually, and
Skin
there
to
are many
skin
skin. The presentation starts off with skin conditions.
A lot of people would not have known this. Like, just like a lot of people did not know that dermatology extends to hair also, which it does. It does.
Yeah.
It also extends to STDs.
Yes,
That is not something that at least I did not know about.
Of course, after finishing our degree, we do fellowships again, studying aesthetics and STDs or lasers, whatever.
Right.
So that's a different thing.
Okay. Interesting. So, doctor, in your, like you've just said, that skincare has changed, your own field has changed completely. So, earlier, what were people coming more for, and what is the number one thing that people come to you today for? Like when it comes to number 1, 2, 3, like top 3, 4, what are the concerns that people usually have versus what they used to have earlier?
So, more than earlier, so people always had this aesthetic inclination. So when we have our own practice, people come to us mostly for aesthetic issues. Yeah, of course there are clinical issues, but they also come to us for aesthetic issues. But unlike in bigger setups like in colleges, we see mainly clinical cases.
Right.
So that's why even after finishing our degree, we have to always update ourselves. I have attended a lot of international conferences. I have done my fellowship in aesthetic dermatology, and till date I keep attending conferences to update myself, which is very much necessary. So even now, of course, the aesthetic patients that I see have increased
that number
in percentage.
Yeah.
And compared to before.
Yeah. I mean, even as normal people, we see how the inclination towards looking a certain way has increased in our lifetimes only, from say when I was a child to now. Exactly. People are much more interested in looking a certain way, having better skin or whatever, compared to when I was much younger. Right. So obviously the number one specialist to get affected by that are dermatologists. Right. So, doctor, I'll start with like the most basic skincare issue that everybody talks about, from children to adults to even older people, and that is acne. Right? Yeah. Like, why does it not go away? Like, that is not my main question, of course. But what causes acne? Why is it so different in so many people? Right? Some people don't have acne issues at all, those lucky few blessed people. And some others have like those who get acne flare-ups, it leaves scarring, it leaves hyperpigmentation, it lasts for a long time. And again, there are many different types of acne, and often it does not go away completely. Like it stays. It keeps coming back, going away, coming back. And I've not heard of a medication that can completely heal acne.
Correct.
So like maybe I don't know enough. Maybe there could be other, right? So what causes acne, and somebody who's really dealing with it, what can they do to make the situations better?
So basically, it depends on their genetic makeup and lifestyle.
Okay.
So it starts off in teenage, even pre-pubertal age group. It can start off then, mainly because of spurt in hormones.
Right.
So when there is spurt in hormones, there is increased secretion of sebum, thickness of the skin, clogging of the pores, and that will act like a breeding ground for bacteria, inflammation, breakout.
Right.
So it starts off then, and usually teenage acne would last until early 20s, and it should subside on its own. But then if you're not following healthy lifestyle, and if you're having genetic hormonal issues, so that can lead to imbalances in the hormones, and these again will trigger acne eruptions. Okay. So that is in 20s.
Again, in adult acne is also quite a big thing.
Yeah,
right?
so adult acne is after 30s.
Oh, okay.
So after 30s, again, it's mostly the same issue, lifestyle changes. But then nowadays, diet also is playing a major role. Okay, like milk, chicken, eggs, sweets, chocolates. I'll tell you in detail if you have questions for that as well.
So basically, foods that may not be suiting you, probably.
Yeah, not necessarily. So certain foods may increase androgens in the body, like male hormones in the body, and certain foods increases like insulin, like growth factors. So that will again stimulate your sebum secretion receptors, and simultaneously you can develop acne eruptions. And they can also cause other issues like period irregularities, especially in women, and infertility, obesity, insulin resistance. So it's a sequel. One can lead to another issue. Okay, and that's why we always see acne, even at 30s, even at 40s. But 85% of adolescents suffer from acne, whereas the percentage starts reducing. It's about 60% in 20s, and 40% in 30s, and 5% in later on.
Older, 40s and
so
above.
It's like that.
Right.
Okay.
So for teens, it's primarily because of hormonal changes in growth
sudden spurt in hormones.
And for adults, it could be because of later hormonal imbalance.
Yeah.
Or because of lifestyle primarily.
Exactly. Yeah.
And bad food, which these days is a part of that lifestyle.
And sleep is also one of the major thing.
Sleep is
it's underrated.
Yeah. So, okay. So I've heard people say that acne is more a symptom than a thing in itself. Like something is not right.
Exactly.
That's why you're having acne flare-ups.
Yeah, rightly said.
Right. So say once you have, like we're saying that teenage acne you mentioned should subside in your 20s, or maybe for some people to a degree slightly later. If you have a decent lifestyle.
Exactly.
Right. So teenagers, those 85% people should not worry.
Yeah.
Like it will go away.
No, it will go away, but you should not ignore.
Oh, okay. So what can they do then?
So basically, so once you develop acne, that it's it can lead to inflammation, and this inflammation can lead to marks or scars. Once you get scars, it's very debilitating for the patients mentally as well as physically, and as well for the parents. And we need to do many invasive procedures, especially like microneedling, CO2 laser, and I cannot assure 100% results even with this invasive treatments.
Right.
Okay, so better to treat it in the early stages.
Better to treat it when it's acne only, not something else.
And so you can avoid scarring and all that.
So say a teenager has acne flare-ups. It's taking care of their skin, like cleanliness will be important. having a cleaner environment, maybe sleeping on clean pillows and things like that.
Yeah,
What else?
those are other things. Initially when you develop acne, of course we need to identify the cause. Once cause is identified and rectified accordingly, then some people do respond to treatments, like oral or topical medicines or chemical peels or lasers, carbon facial, and some people do respond to isotretinoin. So all this, once treatment is done, when there is no flare up of acne, you need to continue certain medications, at least sebum controlling products and all that to maintain it. Okay, so
even if you're a teen, like once you have acne flare-ups, you should probably see a dermatologist and keep it in control so that it does not like lead to any
scarring,
any scarring on any permanent changes in your skin.
Exactly.
Right. Because I was like, you just ignore it, it'll go away.
That's the biggest
Focus
mistake.
on other things.
Yeah.
Right. And for adults, similarly, like for even for teens, what can they do on their own? Like not just, of course, go see a dermat, but what can they do on their own to take care of their acne?
See, basically, first thing is you have to correct your lifestyle, which is very much necessary these days. Like timely food, good sleep, exercise, and avoid late night dinners. Okay, what happens is we have a biological clock. There are certain hormones like melatonin is secreted after sunset and cortisol, early in the mornings. So cortisol is a stress hormone. Okay, so during daytime you're working, you are under pressure, you start releasing stress hormone, and at night the melatonin is an antioxidant. It will try to wash out all these free radicals which we have accumulated throughout the day. So you need to rejuvenate yourself at night. So what I see nowadays is, you don't get enough sleep. Everything else is fine. And, they come and tell, doctor, everything else is fine. I'm using the medicines, but still my problem is not solved.
Sleep.
Yeah. So that's also very much necessary. So we give certain supplements which will also help in, reducing the stress releasing hormones because of sleep deprivation. So there are multiple things,
and this will work for both teens as well as adults, because teens still have hormonal changes. Adults, like half the time it's lifestyle which is causing all this.
Correct.
Right. So,
and of course other minor things they need to follow, like keep your pillow covers clean and make sure not having dandruff. Wash your face with appropriate face wash. It should not be too drying or too it should not make it too oily. Avoid touching your face with your fingers. Avoid using heavy hair masks. So all these are necessary, along with
just
changes.
your basic lifestyle hygiene, which is sleep on time, eat clean food, and essentially take care of yourselves.
Certain foods like milk, it has IGF, insulin-like growth factor, which can stimulate your sebum secreting glands. Okay, so I would never recommend any of my patients with acne milk, especially milk. So yogurt is fine because it has lesser IGF levels. Okay,
but milk can contribute to acne.
Yes.
Ooh, okay. And is it different for men and women, or for girls and boys? This, like the acne is it different for genders?
Yeah, definitely. Like men have thicker skin and they have excess oil production. They have thicker hairs and they're more prone for pigment formation. Okay, so they age faster. So their
they
skin
age faster?
Yeah.
Okay, so I did not know that. Okay.
Their skin is slightly different when compared to female skin. So accordingly, products also should be more cleansing, and they'll have to use sunscreen because they're more outdoors, and they can also pigment
most men, I'm generalizing, sorry to cut you off. Most men don't wear sunscreens.
Yeah, they don't do anything.
They don't do anything. They wash their face and they're like, I'm good.
Yeah. So when I get a male patient, I'll try to keep my prescription simple because, any which ways they don't use it. They're wasting, so that's the thing.
Right. So it is true that skin for men and women therefore is different. So therefore their products have to be a little different.
Yes.
I was wondering if that is all marketing gimmick because I'm like, skin is skin. Wouldn't it be the same for men and women? I've forgotten my biology clearly, but yeah, but it is different for men and women, so the products have to be.
But then if both of you have a little oilier skin or thicker skin, then you can use products accordingly. But then if you're having very sensitive, drier skin and he's having exactly opposite to your skin, then it's not the right thing to do, sharing products.
So you should have some understanding of what your skin is like.
Exactly.
Then for that, you definitely need a dermatologist because most of us have zero understanding of what our skin is like. Right? Got it. Doctor, this thing about face wash again is a very complicated thing. I had almost forgotten that I wanted to talk about face wash, but since we talked about acne, and you said face wash, it just reminded me because these days face wash comes with so many different claims. You can have brightening face washes and face washes with vitamin C that are anti-aging in this face wash and that face wash. It's again a very confusing thing. And many people, especially men, still just wash their face with water out of the door, right? Or soap. So how important is a good face wash? And what kind of a face wash will, without complicating it too much, what kind of a face wash will work for somebody who does not have much acne, normal, regular, happy skin? And what kind of a face wash, what different face wash should someone who has acne use? Just those two kinds. Right.
Yeah, to keep it simple, if you're having normal skin and no breakouts at all, maybe normal to dry skin type, then you can use the face wash with sulfate-free ingredients or paraben-free ingredients. If you have little sensitive, more drier skin, then you can use something with cetyl alcohol or sterile alcohol-based cleansing lotions. If you've heard about it.
Yes.
And if you have oily skin, then you can use something with BHA or salicylic acid. But again, you have to be careful. So I see many people using many actives and they also use BHA based product. So this will cause further drying and then breakout, inflammation, disrupting the barrier layer. So try to choose correctly. And if you feel that some product is suiting you, just continue.
Right. See, this is where it gets confusing for normal people. Like the moment you say actives, I'm now wondering what is it. There is also one thing that I wanted to ask because again, it's a very common term that is used these days in a lot of skincare related videos. But understanding how to use it with other ingredients is something that most of us have no idea about. We can't just throw ingredients on our face. Everybody's skin is different. You just mentioned different face washes for different people, right? So how to then, and you mentioned that for maybe oily skin, you should use something with BHA and salicylic acid. And again, people read labels. I'm also trying to learn, but read. So when, say, somebody is using a face wash with those ingredients, then what kind of actives they can use? And first of all, what are actives? Forget what are actives, right?
So active is nothing but chemical ingredient which we use it on day-to-day basis in most of our products. And they help in skin repair, skin rejuvenation, anti-aging, different properties to different ingredients, basically.
Right.
So
like vitamin C is considered.
Vitamin C, for example, vitamin C
retinol.
Or niacinamide, retinol, peptides.
Yeah. So these are all actives.
All this,
these are all actives. Okay. So broad term actives and these all come under
BHA, PHA.
Okay.
AHA is quite commonly used term though.
Right. Yeah, BHA, AHA is quite commonly used. Right. So say someone with, I know I was pregnant last year, right? That in pregnancy you're not supposed to use retinol. You cannot use retinol. Maybe it's not studied the effect of it on the embryo, but whatever. So then these actives, okay, we'll come to that later maybe. Let's go from face wash to a simple daily routine, because we've heard, again, anybody who's paying attention has heard about what your daily skincare routine should be: your cleansing, toning, moisturizing, and sunscreen. Largely, this is what it should be, right? And should that be like a staple thing which everybody, men and women both, should follow?
See, not necessarily. It depends, So for men, if they're not men, even it could be women. So if you're not a person who could follow, all the steps properly, if you want to keep it simple, face wash, sunscreen in the morning, a moisturizer at night. That should be sufficient. Okay. But
thank you for that.
Yeah, I know. Do not complicate yourselves.
Yes.
Then if you want to stick to certain regime, then you have to extend little more further. Then face wash, you can use an active in the mornings, like say vitamin C or niacinamide, and moisturize, sunscreen. For nights, if you want more skin rejuvenating, anti-aging properties, or retinol at night. But again, try to take guidance from the dermatologist and then start off this regime. Don't do it on your own. Of course, you were talking about pregnancy retinol, right?
Yes.
So in pregnancy, retinols, of course, there are no proper studies about topical retinols. Oral retinols as well, we don't give it at all because it can cause fetal defects. It's teratogenic. Okay.
What does that mean, doctor?
So basically, it causes defects in the child. So we don't recommend that at all. In fact, when we give oral retinoids, we ask them to take at least 3 months gap. If it's for acne, isotretinoin, we ask them to take at least 3 months gap before conceiving.
Isotretinoin is also a retinol.
A retinoid, yeah.
Right. Okay. That is very helpful, doctor. Definitely. So, just for simplicity's sake, morning wash your face, use a sunscreen, night use a moisturizer. If you want to do anything advanced, see your dermatologist, know your skin type, and then you can add actives to your routine.
Correct.
Right. Got it. And doctor, and retinol is also like you're not supposed to use it postpartum also, right?
Postpartum, you can use it.
Oh, you
Anytime
can?
after that, you can use it.
Oh, okay.
Pregnancy is the only contraindication time period.
Right. Okay. So postpartum,
so it's hardly secreted in the blood. In the breast milk. So
that is good to know, because I was under the I thought that even postpartum you're not supposed to use retinol.
No, topical retinol. Just that contact with the child should not be there. Direct contact.
Right. Even if you're breastfeeding, it's fine to use retinol.
Not at all.
So just for anybody who does not know what retinol is, retinol is considered to be one of the better anti-aging actives out there, right?
It's a vitamin A chemical derivative.
Right.
So it comes in different forms like retinol, retinoic acid, retinaldehyde. So retinol and retinaldehyde is used for anti-aging purposes, and retinoic acid, which comes in the form of retinol or adapalene. Sorry, more medical terms.
It's okay.
So that's for acne.
Okay. Got it, doctor. No, that is helpful. And so, what are these actives primarily used for? So, retinol is, from what I understand, is used for anti-aging primarily. Is that correct?
Yeah.
And vitamin C is usually for...
It's an antioxidant, and it also has anti-aging properties. Say you're 20s or something, you want to start off with an anti-aging product, but want to keep it mild. Vitamin C is the good product.
Okay. So vitamin C is your beginner anti-aging routine starter.
Exactly.
Right. So doctor, we talked so much about acne, but I forgot to ask you one thing. we're in these modern times where people have tiny attention spans. So just for the sake of everybody, I wanted to ask, what are some myths that you want to burst about acne? Right? Some top misinformation that you want to remove.
So one point already we spoke, that's like, it could be teenagers or their parents. They usually think that acne would go away and try to delay taking treatment.
Right.
So acne is a continuous process, and it's now categorized under lifestyle disorder. So you need to start off treatment in the beginning itself, and you can always avoid scar formation in future, because that would require multiple invasive treatments, which would
Cost time, money.
Yes,
Bring
of
you,
course.
anxiety.
So that is one thing. And some people think adults don't get acne. This is a common question, and they're they're really frustrated. I never got acne in my teenage. Why now, doctor? Because lifestyle again. Okay, and a body becomes sensitive after 30. You're no more like 20s. So your collagen starts to degrade, hyaluronic acid degrades, your bone starts to resorb. So overall, our body process of producing antioxidants will start decreasing. So you need to work more harder than before. With respect to health, skin health, and physical
take better
and
care of
mental health.
yourself.
Yeah, of course.
Right. Okay, that makes sense. And for that, I guess number one will be sleep. Which everyone's sleep is like down the drain.
Especially in urban areas.
In urban centers. Yeah. And then we were talking about actives, doctor, which you explained so beautifully. But if someone were to introduce actives, more than one active, say in that lifestyle, then how do you layer them? What works with what and what does not work with one another? Because you'll find products in the market which has more than one actives in that. And that really confuses me. I'm like, I stay away because I don't know what to do with it. Right? So how do you layer these actives?
So more than layering, you need to know the texture of the product. So, for example, after you wash your face, if you are using a lighter serum-based product as an active, so try to use that first. And then you can apply a thick moisturizer, and sunscreen would be in the end. Okay.
So go from thinner to thicker.
Thinner to thicker product. But of course, sunscreen is always the last step. Okay. So never do anything above sunscreen. But if you have to use makeup, light makeup or something, you can mix it with sunscreen, or nowadays tinted sunscreens are available. You can just use tinted sunscreen as a finishing product.
Right. But you can use whatever actives you want to if you're layering them right. Like texture wise. Thinner to thicker if you're going, you can use whatever combination you need for your skin.
So like say for example, you're using retinol. Okay, but you have very dry skin, sensitive skin. So then what we will advise is try to sandwich the product. So you wash your face, apply a light moisturizer like hyaluronic acid based serum first, and then you can apply retinol cream. Then you can apply again moisturizer that can be little thicker. Okay. So for your night routine.
Got it. Retinol should be applied generally at night only, right?
Retinol, yeah, definitely.
Right.
Because it can cause photosensitivity. That means when you go out in the sun, you can start to burn more.
Even with sunscreen?
Even with sunscreen. So never apply retinol in the daytime.
In the daytime. Got it. That is good information. I'm sure a lot of people are going to benefit from this.
Sorry to cut you.
No, it's okay.
Sometimes even vitamin C.
Yeah.
Vitamin C, if you're using an unstable vitamin C product, it can get oxidized on your skin.
Right.
And once the product gets oxidized, your skin can look darker, or sometimes it will start damaging your skin. than doing good.
Right,
so
right.
according to the product, basically retinol should be at night. Sometimes vitamin C also I would recommend at night,
right,
based on the product
Based on the
stability.
Based on use a stable vitamin C.
Yeah.
And how do you know it's a stable vitamin C?
So basically, it will be mentioned in the product, stable ascorbic acid or magnesium ascorbyl phosphate. So there are different, byproducts of vitamin C, which are generally mentioned in the product label itself.
It's mentioned as
like
a stable formulation.
Vitamin C. Yeah.
Okay, got it. Yeah, no, that makes sense. But doctor, so sunscreen you mentioned should be the last thing always, no matter what layering you're doing.
Yes,
right?
yes.
Sunscreen is also something that Indians are really bad at. Right? We don't use, still a lot of people don't use sunscreen. Right? So, how important is sunscreen? I've also heard that you should be reapplying your sunscreen every 2 hours. These days, you also get those sunscreen sticks, right, that you can use over your makeup. Right? So, how much sunscreen should a normal person apply, and how often should they apply it?
So basically, sunscreen, it depends, if it depends on your age group, and it depends on your working exposure to
The sun.
different radiations.
Right.
Like say, if you're an indoor person, you're always in front of screen, because these screens also emit radiation. So that's blue light, okay, which is normally above 400 nanometer. So this can also cause photo aging and pigment formation. So if you're an indoor person, prefer a sunscreen which has protection against blue light as well. Okay, but if you're an outdoor person, okay, try to use something more physical, thicker sunscreens, and a higher SPF which has UVB and UVA protection. So UVB protection, it's SPF. Like say if you're using SPF 50, it protects your skin up to 98%.
Okay.
So only 2% radiation can penetrate your skin.
Got it.
Okay, but if you are using something with, if you've seen label with PA triple plus or 4 plus, that gives protection against UVA.
Got
okay.
it.
So generally, UVA radiation causes more damage. It causes photo aging. UVB will cause sunburn.
Oh.
Okay, so you need to protect yourself against both when you are outdoors. Okay, so that's necessary. Basically, you can buy a sunscreen which is hybrid, which
Both
has protection
UVA,
against
UVB.
UVA, UVB,
Blue
light, and infrared radiation. Infrared radiations are emitted by these devices which emit heat.
Got
okay.
it. So even if you are indoors, you should be wearing sunscreen.
Yes.
I mean, if you're working in front of a screen, or if you're working under the lights.
Under the lights,
if you've got like tube lights or lights on, you should be wearing your sunscreen.
Yes.
And how often should you reapply it?
And again, if you're an outdoor person with a lot of outdoor activities, then you can reapply every 2-3 hours or 4 hours. You can keep the buffer. But then if you're an indoor person, maybe twice
a day.
Morning, like around 8ish or 9ish, and then you can apply it around 3-4.
Okay. But still much more doable than every 2 hours.
Yeah.
And are those sunscreen sticks useful, doctor? Like I've been seeing a lot of those sunscreen sticks these days that you can apply.
You can use it as long as it has all this, SPF and PA protection and blue light protection.
Right.
But you need to look for consistency. If it suits you, if it's too oily and sticky for an acne-prone skin, they can develop more eruptions, breakouts. So try to use product accordingly. Yeah,
that works.
More matte finish will work for acne-prone, oily skin. And moisturizing sunscreens are also available, more lighter textured ones. So that is good for dry skin. And you were also asking about quantity that should be applied, right?
Yeah.
So, like say there are ways to apply. One is finger rule, and the other one is teaspoon rule.
Okay.
Okay.
Right.
So if you are using finger rule, 2 full fingers from the tip of the finger till the palm are crease. So you need to take 2 full fingers for your face and neck.
Got it.
Same amount of sunscreen for your, so you divide your body into 11 areas. So 2 full fingers for each arm, then upper front torso, lower front torso, upper back, lower back, legs, thighs. Okay, so 2 finger each area.
A lot of sunscreen.
Yeah, so if you're outdoor and if you are exposing most of your skin, so then you definitely have to use this much amount of sunscreen for better protection. Okay, and if you're following teaspoon rule, that is 9 teaspoons. 1 teaspoon is about 5 grams. So that 1 teaspoon should be enough for your head, neck, face. Okay, and same way, 1 teaspoon for each arm and upper torso, full front torso and full back torso, and legs, thighs.
Wow. I'm going to have to check how much 1 teaspoon is in my hands so that I can then just follow.
I feel finger rule is
works better.
Yeah.
Okay. Okay. That's good to know. And doctor, for children, because children don't wear anything, don't wear sunscreen, don't care, right? But they should also be wearing sunscreen, no? Like if you're a teen or even a younger, like a 5-year-old, a 7-year-old, a 9-year-old who's playing outside, right? Especially in summer holidays, playing outside the whole day. Should they not be wearing sunscreen?
Yeah, unless you're exposing the child to very harsh rays or the mid sun, like say between 11 to 3 or 4, and a lot of outdoor activities, swimming, then definitely you need to use sunscreen. But again, I would prefer using physical sunscreen.
Right.
Not chemical
that is
sunscreen.
Also there, right? Physical and chemical sunscreen.
So physical sunscreens are those which, when applied, they stay on the skin. They don't undergo any chemical reaction. They don't penetrate into the skin. So whereas chemical sunscreens, they undergo changes when it comes in contact with the sunlight.
Got it.
Okay, so I don't, and they also penetrate into the skin. There are a lot of ingredients in the sunscreen which can cause, hormonal changes. They can act like endocrine disruptors, attaching to your receptors in the body organs. They can simulate hormone production and they can also damage the cells. Okay,
so for children, better go for physical sunscreen, not chemical sunscreen.
Not chemical.
And is that also like written on the sunscreens, or
it's not generally mentioned? So
physical sunscreen is also called mineral sunscreen.
Mineral sunscreen, yeah.
Just to.
So usually it should contain zinc oxide and titanium dioxide. Okay. So these are physical sunscreens. Right. But there are a lot of chemical sunscreens with avobenzone, oxybenzone, cinnamates, even benzophenols. These are all kind of banned actually. They are not necessarily good for the skin. Okay, so I personally don't prefer chemical sunscreens.
Right, and that's
even if it could be adult.
For adults also,
for adults also, if it's really necessary, then
like if you're not finding any other sunscreen or somewhere, then maybe go for a chemical one. But otherwise,
texture and all, because mostly physical sunscreens they cast white residue on the skin.
Yes, this is why. White cast. Right, but they're still better for you rather than a chemical sunscreen.
Yeah, there are some sunscreens which hide them, like tinted sunscreens and all that. They also give protection against blue light and infrared radiation. Such sunscreens can be used by an adult as well.
Got it. And this is also, we were talking about pregnant women, and I remembered that you're not supposed to, if you're pregnant, you're not supposed to use chemical sunscreen, right?
Yeah, so if you're pregnant, you should avoid many things, Better keep it simple, just a simple face wash and a moisturizer Sunscreen when you're stepping out, sunscreen, physical sunscreen. Don't try to use too many products when you're pregnant. Even if it could be vitamins, yeah.
So say your actives, retinol, we know we shouldn't use as a
Actives
pregnant
also, I wouldn't recommend even actives. Just try to stay away from all the products. Maybe if at all you want to use, if vitamin C suits you, you can just continue. But try to, stay away from all the products, because we don't know, there are not enough studies. There are cocktail of ingredients, sometimes the preservatives themselves. We're using it, skin absorbs the product. So people usually think, skin, anything you can apply, it doesn't penetrate into your body. It absorbs the product, it penetrates into your bloodstream. It can reach your baby, the fetus. Okay, so try to be careful when you're using.
So keep it simple when you're pregnant. Just your moisturizers and sunscreen. And if you want to do anything extra, maybe go for a vitamin C.
Or even AHA is also safe.
Yeah, okay. So, doctor, we talked about skincare, right? And the different types of skincare, how you should use it, how you should layer it, and how Indians don't use it. Don't use it as much as they should, right? What other things, what are the top 3 mistakes that Indians make when it comes to skincare? 3, 5, however many you can think of. Like, what are we doing grossly wrong? So, yeah.
See, one thing is sunscreens. When you're applying sunscreen, so you just in hurry you apply it and then you just walk out. So ideally, if it's a chemical sunscreen, you need to apply half an hour before stepping out. Only then the sunscreen will be effective. You should allow the sunscreen to sink into your skin. Okay, and then step out. Then it will be effective. But if you are using a physical sunscreen, you can give 5-10 minutes gap. That's it, huh?
Oh.
Okay. So that is one mistake generally people do. And not applying adequate amount of sunscreen.
Okay.
So I get patients saying I apply sunscreen but still I get tanned. Okay, that's because they're not applying adequate amount of sunscreen. As I already told, 2-finger rule for full face and neck.
Yeah.
Okay, and reapply every 2-3 hours. Okay, that's important.
Right.
And some people use very thick hair masks. Okay, so and curling products and all that. So they actually weigh down your hair, and they can also clog your pores. If it can also cause damages to your skin. Like it can clog your pores. It can trigger acne. So I would not recommend very thick products for your hair. Okay, in the form of conditioners or masks. Light conditioner and try to wash backwards, and make sure you're not washing with hair
down like this.
Yeah.
Oh, okay. Why is that, doctor?
Because these are thick products, they contain emollients and all that. So when it comes in, or fatty acids, so when it comes in contact with the skin, it can actually start building up on the skin. Doesn't get washed away. Or what you can do, if after you wash your hair, you can wash your face, so that whatever would have accumulated on your skin get washed away. Okay.
That's very good information, doctor. Because many of us, myself included, wash our hair down like this, right? The idea is to thoroughly wash hair, but had no idea that this could happen. Okay, very, very important. Yeah. And doctor, with so many products that are flooding the market, left, right, center, what are some products that are completely useless that we should not bother about only and, not think about them? Yeah, if you could, yeah.
There are many products like acne patches. People use acne patches just to clear that acne overnight. Instead, you can use a product. You're anyway using a product for acne suggested by dermatologists. There are like few concentrated products. You can use that. It will help in reducing acne overnight. Okay, so you can. I feel it's a waste of money spending on that.
Acne patches.
Acne patches.
Yeah.
And there are also acne wipes. I feel that's also one of the product which you should not waste time on.
Right.
And even lip scrubs, like coffee lip scrubs or sugar lip scrubs. because lip is a mucous area. Okay, so generally, on day-to-day basis, it just exfoliates on its own. Unless you see some buildup, you see some whitish buildup on your lips. That's mainly because of the product that you're using, like Vaseline petroleum jelly or any lip balm. Then you can, while you're brushing, gently you can, scrub on the lips, but not on daily basis, weekly once or so. Okay, but not with the toothpaste. Wet the skin and then
just the toothbrush.
Yeah,
wet
you can use a moisturizer and then do. Okay, so that will help, but never use. And moreover, when you scrub more, you need to protect more, because your skin is more exposed and you can get more tanned, and the skin can get dry, and they can also end up developing lip cheilitis or allergies. It can disrupt the skin barrier layer, basically. So that's one other point.
Right.
Okay, and skin toners. Okay, skin toners are outdated actually now. Why? Because earlier teens or those who have oily skin used to use astringent based toners.
Yes, I remember.
Just to dry the skin and zap the pimples like that. But then that would also cause drying of the skin, and it can also disrupt your barrier layer if you're not using right concentration and all that. But now we have many actives. So like AHA, BHA products. Already the products that we're using have these ingredients. You really don't have to use a toner if you're following proper regime.
So doctor, earlier they used to say like toning is essential, right? Cleansing, toning, that moisturizing and all. So now you can just cleanse and do moisturizing. And
so
then
you're
go
using
to
a product, right? Like an active. You're using vitamin C active serum after washing your face. So that will act like a toner. Or you're using AHA based product. So that will also act like a toner. Okay,
so there's no need to use your.
So basically the purpose of using toner is to, just clean that extra dirt and, make sure that pores tighten up a little bit. If you want that to happen, you can wash your face with cold water. Okay, you must have heard about cold water dunking.
Or just apply like a ice.
Direct ice you should not be applying. Okay, so you can roll it in a cotton gauze or cloth, and then you can just add it all over your face, or you can just splash cold water on your face.
Right, and
so that will help in tightening your pores.
That is useful, doctor. Doctor, we've talked quite a bit about AHA, BHA products. Aren't those generally found in like your chemical peels? Right, but those you should only use once a while, right? Not like on a regular basis. Like your peels should only be used like once in 10 days or something like that?
So it depends on the concentration that you're using.
Okay.
So like say you're using 1%. So usually generally the face washes contain 1% of AHA or 2% maximum. Okay, and if you're using a product for daily use, depends on combination with other ingredients. Okay, you can use maybe 2% or 3% for daily use. Okay, but weekly one 6% or something like that. So again, you need to consult dermatologist according to your skin type. They would recommend what percentage is safe for you, and then you can use those products.
So our discussion is a general guideline of do's and don'ts, but for more specific advice, it's always best to see a dermatologist.
Yes.
Right. And doctor, we've been talking quite a bit about disruption of skin barrier. What is your skin barrier and how does it get disrupted? Like we've talked about so many products that can disrupt it, or So what and how do you repair it? Can you repair it by yourself? Should you go see a dermatologist for that?
So some people also use a lot of herbal products, and some are used to using
especially in India.
Especially in India. like directly using lemon on the skin, or onion or garlic on acne. Okay, and even onion oil for your scalp.
Yes,
okay,
yes. Quite common these days, onion oil.
Very common.
Yeah.
So it depends. These they have very strong active ingredients. Okay, and you don't know the concentration, and if you don't know your skin type, you directly use those products, you can end up burning your skin. So, and repairing that skin is a big task for dermatologists. Okay,
Wow.
but if you are using many actives like AHA, BHA products, someone who is very overzealous and tries to use all the
Too
ingredients, okay, they can end up
disrupting
having
that.
Yeah, they can damage the skin barrier layer. What happens then is the skin tries to, there is difference in the skin oil secretion. Your perioral area can become very dry, other areas can become oily, and your pH gets, imbalanced. Okay, and the inflammatory mediators will start increasing in the skin. This can also trigger acne eruption. Okay, so better to keep it simple. When you don't know anything,
do less. Don't do too much.
Do less. Yeah.
That is like good advice throughout the video that you've been giving. Keep it simple. Do less. If you want to do more, see a dermatologist.
If you are really having a problematic skin, meet a dermatologist. Like, say, some people have very dry, sensitive skin, they cannot tolerate sun, and some people have allergy flare up like eczema, psoriasis, atopic dermatitis. They don't know what is triggering this flare up. Okay, so then you definitely have to meet a dermatologist and take proper advice, and they'll guide you which is right for you, and you can maintain. Some people have seasonal variation.
That too happen. Like your skin is different in different seasons.
So you need to, so you can visit twice, like during summer once, and then during winter once, and get the proper suggestion about which products will be right for you. Then you can continue using the same later in your life.
No, that makes a lot of sense. Actually, Doctor, what was it that I wanted to ask you? Yeah. No, I remember. Because there's so much, right? I'm like, this also I should ask this also. Then while I'm talking to you, I'm like, oh, yes, this also I want to know. Right. Okay. So what I wanted to ask was, there's not just a lot of ingredients. There are also a lot of procedures, skin related, right? The most famous one being Botox. Then there are fillers. Then there is microderma abrasion, which is a long name, right? So there's so many things. Which of these procedures can actually help people, and maybe people can consider it sometimes, and which procedures people should not go for? It's a fad and it's just a waste of money, right? So if you could let us know a little bit about that.
So again, it depends how much you want to maintain your skin, how much you're concerned about your skin issues, and what you really want to address. What's your skincare goal? So based on that, we devise the treatment. Okay, so say for example, you want to focus on anti-aging.
That is a very popular one these days.
So you need to start anti-aging treatments, like procedures especially. You can start like before 30s. Just keep it simple with mild peels or hydrafacial or some medifacials.
Is another one.
Okay, and mild, BHA peels like that. That would be sufficient at 20s. Okay, 30s, you can start off. Basically, dark circles will start showing up. 30s onwards, and skin will start sagging from your eye area. The ligaments in the peri-orbital area, this area will start sagging downwards, and eventually this cheek area will start sagging downwards, and jowls will start appearing. Your jawline will start getting disfigured, and your contour will be lost. So basically, and your wrinkles, deep, the dynamic wrinkles will start showing up. Okay. So you were talking about Botox. So Botox is good for dynamic wrinkles. So when at 30s, these dynamic wrinkles will start showing up, at least in Indian skin.
Wrinkles?
Like say, for example, these are nothing but expression lines.
Oh, so like if I laugh and I get laugh lines.
Yeah, laugh lines. This is called
crinkle.
nasolabial line, and this is marionette line, and these are crow's feet, frown line, surprise lines. So these are different lines. So generally we start seeing crow's feet, which is very common. I would recommend, going for Botox for this crow's feet area, because if you ignore, as you grow older, 40s, these dynamic lines can start becoming static. So then the treatment will be little tougher. We the fillers also we cannot. We have to do lasers and all that. I cannot really assure that that will go away. So if you want to avoid that, start Botox in the earlier age group.
Like 30s.
Yeah. Okay. So later, for sagging, if you want some lift, okay, there is non-invasive HIFU, high intensity focus ultrasound, that will target your fat tissue and will tighten your tissue which is below the fat. Yeah, facelift. So if you start sagging, if you want to go for non-invasive treatments, HIFU is good. 30s, okay. So then 40s, I would start, fillers. Fillers will help in, because there is sunken temple region, sunken cheek region, and
start losing your fat.
Yeah. So, we give fillers in the zygomatic area, so it will give a lift, nice lift to your cheek. So that's one thing I would recommend starting at 40s. And there are other, the medifacials or laser toning just for detan and, tighten your pores. And if you have acne prone skin, like scarred skin, then I would recommend microneedling or a CO2 laser. Okay, so there are a number of procedures, and then
basis what your skin really needs.
Yeah. Right. And there are many other surgical options, like if you are having too much buccal fat removal, double chin removal, thread lift for facelift. Okay, and
right. So the previous ones are not surgical; they're non-invasive.
Yeah.
But these are surgical
mostly
procedures.
Surgical, yeah.
Right. Got it. So this is surgical, is what we'll call plastic surgery. Right?
Yeah.
Right.
So plastic surgery, even dermatologists do it, and even plastic surgeons do it. Sometimes we coordinate with our surgeons. Say in our clinic, we have, my husband is a plastic surgeon.
Yeah, I was coming to that. Yeah.
So we work together. So if it needs more invasive approach, then I would recommend
the candidate to a plastic surgeon. Yeah. Right. Okay, then are there any procedures, because these days there are so many which are because so many are going around, right? Yes. Are there any procedures which you say are not necessarily required by most people, right? And like people should not, or generally everything has some value to somebody. Like, is there anything which you'll say that is not needed? If
your skin is already clear and you really don't have any issues, then unnecessarily doing peels, chemical peels, all this can further damage your skin, and some people just do a peel before going out. Okay, before going out for a vacation or any tropical area. So, okay, they get more tanned. Okay, so, and some are already using it. Already using these peels at home. Okay, like HA, BHA in concentrated formulations. Yes. Okay, they're already using it. Right, so that can also cause more damage, more tan, when you are not stopping the product and just going out and exposing your skin to sun, because these products exfoliate and it increases skin turnover. So whenever there is more fresh skin,
it'll get tan
skin
easily.
Needs some time to harden for sun exposure.
Oh.
Okay.
So basically, don't fix what ain't broke. And if you have good skin, don't go around doing everything that other people are doing. Be thankful and stay at home.
Yeah, of course.
Yeah. Because oftentimes people will get pressured that, oh, these people are doing so much and I'm not doing anything. And, maybe my anti-aging, maybe I'll start aging faster, something like that. But maybe your face does not need it. Right? Yeah. That's a good one. I also wanted to say, like, we mentioned that for a lot of people, actually, it is for a lot of people. Like, often you will see this people categorizing skin as dry skin, combination skin, but often it is according to seasons, right? Like, often for people, skin will, maybe even if you have combination skin, it will get drier in winters. Also depends on the climate or where you stay and so on and so forth. So, they should at least see a dermatologist once in winter and once in summer to get their routine sorted.
Yeah.
But is routinely seeing a dermatologist something that you will recommend? Like, just like you get routine physical exams, full medical checkup done once a year, right? Should going and seeing a dermatologist also be a part of people's lifestyles? Like just a routine checkup thing?
See, what happens is I see a lot of teenagers or 20s age group coming to me for skin issues. Okay, but what I also notice is they are also going bald. The hair is also getting affected, but they're not aware. They're not aware about it.
Teenagers?
Yeah, nowadays teenagers as well, because of metabolic changes and bad lifestyle. So this is something which goes unnoticed, and they come to me when they really have an issue. At that situation, it gets very difficult for us to address that. We have to do so many other things, and sometimes it cannot even be fixed. So if you are but there are other clinically very important conditions which you have to go for routine checkup and get sorted. Like if you have a mole or any growth, and if you're not aware about it, that sometimes it can also be cancerous. Okay, so you need to get routinely checked with the dermatologist, if that's okay, or if the dermatologist recommends that you need to go for a routine checkup or follow up every 6 months, then definitely you need to not ignore.
So basically, if you see, like, to be conscious, be a little aware of your body, and when you see something which is not normal, definitely go and get it checked. Like, don't be like, it's okay. We as Indians, we do have that mindset when it comes to skin, it'll go away. Right? So let's not do that. Even if you don't go for, say, like, yearly checkups, definitely stay aware of your body and go when you see something different. Right? No, that's fair. So, doctor, another thing, apart from all the products and all the ingredients that are flooding the market, another thing is supplements, right? We have supplements for everything, but we also have so many skin supplements, multivitamins for skin, your collagen boosters for skin, herbal, non-herbal. Do any of these work? And as a dermatologist, do you sometimes have to prescribe supplements to your patients? Like, how does that work? Are any supplements actually useful?
So again, it depends on what ailments you have. Like say you have only a skin issue, like acne issue. Okay, so then I would recommend something which has inositol or something which has lactium. These are different molecules, or something which has a lot of antioxidants, which will help in balancing your hormones and all that.
But they help.
But they help.
Okay, that's good to know.
Not something which they can take on their own, though.
Right.
Like if you have hair issue, so something which has multivitamins, minerals, antioxidants, because hair is widely affected by all of this. overall deficiency, and even stress can also cause hair loss. I would recommend a cocktail of all this. Okay. And if you have B12 deficiency,
that's a big one in Indians, right? B12 deficiency,
B12
iron deficiency, both.
iron, vitamin D deficiency, iron, B12 and all can cause dark circles, perioral pigmentation.
Yeah, this is also very common. Pigmentation around mouth. Is perioral like pigmentation around mouth? Is that what it is?
Yeah, exactly. Okay. So that then I would recommend giving those supplements. Okay. And vitamin D deficiency can also affect your skin. It can cause changes in the metabolism and even changes in the hormones. So I would recommend vitamin D supplements. Even hair cycle can get affected. So I would.
So supplements, doctors will
depending
recommend
on the issue.
But you shouldn't take them on your own, I suppose, right?
Like say for example,
self-medicate you shouldn't.
Self-medication, I would not recommend. You can focus on your diet rather than taking supplements. Supplements are just supplements. But then there are some people who don't eat proper food and they just take supplements. There's no point, right? So let's say you want to focus on your skin, you want a good glowing skin, take more of superfoods which are antioxidant rich, like vitamin C or omega rich supplements like walnuts, flax seeds, chia seeds, fish. Okay, so they also, omega also has antioxidant properties. So that helps for, dry skin conditions as well.
Right.
But again, I feel you need to get the right guidance and then take the supplements based on your issue rather than just randomly taking some supplement. But if you have a joint issue, you can take calcium supplement with glucosamine or something like that. Okay.
So supplements, again, like most other things, should be taken under doctor's guidance. Don't self-medicate. If you want to help yourself, maybe focus on sleep and you're eating good food.
Good lifestyle.
Yeah, good lifestyle. Yeah, this is becoming a hallmark of our times, actually, that we don't have anything sorted. Food, sleep, vitamin D. And we try to fix it through medication, through supplements. That's just how it is right now. Right? Like we mentioned, vitamin D deficiency. And I'm sure most of the engineers, or at least a high chunk of them in Bangalore, have that because we are always indoors, right? And so their skin would also be showing signs of that vitamin D deficiency, right? Is there something that people who work indoors, like IT professionals, be aware of, apart from using blue light SPF that you mentioned?
So, vitamin D get produced in the skin only when your skin comes in contact with the UV radiation. That is sun.
Right.
Okay. So ideally, at least 15 to 20 minutes of sun exposure is necessary. Like say if it's mid-sun, 10 minutes of sun exposure. Okay, for on daily basis to produce enough amount of vitamin D.
This is without sunscreen, right?
Without sunscreen, yeah. So with sunscreen, you are blocking all the radiations, right? Okay. And vitamin D deficiency can also cause lot of changes in your skin and hair, bones. So supplementation may be necessary for those who are always indoors. So check your
deficient.
Check your vitamin D levels yearly once or so, and try to take supplements accordingly. There are injections which are available, or supplements, just oral supplements. But don't overdose yourself. I see many people, they just keep taking vitamin D on their own, even without doctor's prescription, thinking that will, sort out everything. But there's something called hypertoxicosis. Okay, so in order to prevent all that, just get an annual checkup and then take required amount of supplements.
Too much of a good thing is also a bad thing. Right. Interesting. And doctor, this is another thing that happens, especially in today's times. People move around a lot, go from their hometown to some other city. Then they develop all these especially hair fall, they develop. And then everybody's always blaming the water. People move to Bangalore and they're like, oh, the water is, I'm like, it's Kaveri water. Why will it be bad? But, the water is affecting them somehow and they have started to get hair fall, right? So is it really the water? What is really causing these changes when you move cities, and how can people like help themselves? Yeah.
So it's not basically Bangalore as such. So when there is change in the body, like you move from one place to other place, so the body needs to adapt itself. You're undergoing mentally and physically. There's so much going on around you, right? So you're under pressure. So this stress, can actually build up within your body, and hair will get affected, because hair being a highly metabolic organ, so body will try to divert all the nutrients to the vital organs. Okay, so during that period, that phase of stress, okay, if it's not only like place change, it could be any mental stress or sometimes illness.
Like even breastfeeding, I think, causes hair fall because body diverts nutrition to like other
No,
organs.
I'll come to that.
Okay, later then. Let me not confuse. Yes, please carry on. Yeah.
So that's the main reason for hair loss. But then if you have any other deficiency associated with it, other hormonal issues, the hair loss will continue to persist. Because only because of the place change, the hair loss will get sorted on its own. But the water, again, if the TDS levels are too high.
What are TDS levels,
doctor? TDS level, it determines the hardness of the water. Okay, so it contains a lot of salts and minerals. Right, so these minerals build up on your scalp and hair, are quite corrosive for your hair and scalp, and they can damage your follicles and then cause hair loss. But then that's the last thing that you should think about, because first you should sort your lifestyle and any nutritional deficiency, any hormonal issues, and then think about your water. Okay,
it's not the first thing that's affecting your hair. It's everything else.
Yeah, of course.
Right.
You can use products accordingly, or you can use a water softener if everything else is sorted out.
Right. Just using a water softener or products is not going to help sort your hair when everything else is not working. Right. Coming to the distraction that I created right now, what causes hair fall postpartum while women are breastfeeding if it's not that? Right.
So basically what happens in pregnancy, there is this progesterone hormone, okay, which is secreted for sustaining the pregnancy. Okay, so this hormone will actually prolong the hair cycle, hair growth cycle. Okay, the phase. So because it's prolonged, after delivery, the progesterone hormone will start slowly wearing out. That's why you don't see hair loss immediately after delivery as well. You don't. So it takes some time, 2-3 months later, you'll start noticing hair loss. Okay, because that hair growth phase itself was prolonged. So those hairs are shedding now. So it's not the hair loss because of deficiency or whatsoever. And
good to know.
Then if you are having any pre-existing deficiency, that hair loss may continue to shed even for months. Okay, after 2-3 months, generally it should last for 2-3 months. Okay, it should not be more than that. If it's prolonged, then meet your doctor and get sorted out.
Okay, so your postpartum hair fall should not last longer than 3 months post delivery. If it's lasting longer, see your dermatologist.
Yes.
Got it. That might be because of some other issues. That is good information. That is very good information. Yeah, thank you so much, doctor. This has been a very informative episode again. Like so many skincare confusions cleared by you. And thank you so much for coming and sharing so much information with us. And we'd love to have you again in the future whenever you have time. We would like to go more in detail about hair. Today we were more focused on skin because skincare market is just very confusing, but hair care is not far behind. So maybe someday, whenever you have time, we can sit down and talk more in depth about hair fall, hair concerns, hair care, and all that. But thank you so much for giving your time today. Yeah, we really appreciate it.
Sure, we can do that. I'm really happy that I could answer all your questions or doubts. Happy that it would cater to larger crowd and answer their questions as well, our doubts. And it's a pleasure being here. Thank you so much for calling.
Thank you.
Thanks for the team as well.
Yeah.
For making me feel like home. Yeah.
That is great to know. We aim to please. So thank you. So this was the end of today's podcast. Dr. Nithya made skincare so simple for us. I feel like today's episode was a great guide to everyone who was even a beginner at skincare. And so whether you're a beginner, whether you're more advanced, please share this video with people whom you want to have more insights in skincare. It's such an important subject in today's times with so many pollutants affecting our face. So please like this video, please share it forward, and more importantly, please subscribe to our channel. If you watched this video, subscribing is absolutely free for you, but it helps us make content for you. So please subscribe and please come back for the next podcast. Thank you.